I'm Dr. Christopher Schumacher. I'm a sports medicine orthopedic surgeon here at the Bone and Joint Care Center. You know, it's just what I was drawn to. I liked orthopedic surgery, and within that you can go into a bunch of different fields, and sports medicine is just what I connected with the most. I like to sit and get to know my patients because they're not just a knee or a shoulder. You know, I like to get to know what they want to do and what their goals are. And then, you know, we tackle what their issue is and what the best way to get them back to it is. And typically that's starting with things that are less invasive, physical therapy, medicines, things like that, knee braces, wrist braces, and then, you know, all the way up to things that, you know, are more invasive but might be necessary, surgery, injections, things like that. The surgeries I do mostly are arthroscopic, mostly knee and shoulder, so ACL reconstructions, meniscus repairs, and in the shoulder, rotator cuff repairs, dislocation stability surgery, so labral repairs, bicep tendon repairs, and in the upper extremity as well, I do some hand surgery like carpal tunnel surgery, cubital tunnel surgery, trigger fingers. There's a lot of technology and a lot of advancement going on. You know, since I've started, there's been all kinds of things, but I'm really excited about the advancement in arthroscopy. We're doing more and more things through a scope, through tiny little incisions. You know, it just makes the recovery better, faster, easier. It makes the risks lower. Just listen to your surgeon, do whatever they say. No, I think it's you just have to work hard. You know, it's the surgery. I always tell patients the surgery is a really small part of this whole thing. You know, it seems like the most important, but it's, you know, an hour or two right at the beginning, and then it's, you know, months of recovery sometimes. So it's a really small part of this. And so whenever you're doing something like this, it's not, you know, it's not one person, it's not just me, you know, it's the whole team. It's from the person that takes the phone call at the front desk to get the person scheduled to you know, the nurse or medical assistant bringing them back to the room, to the physical therapist, you know, getting people rehab. I think it's knowing your patients and having the patients know the providers they're coming to see, and I think that's what sets the Bone and Joint Care Center apart. So that's why I'm really, you know, excited and happy to be working with them.